Hi, and thank you for agreeing to participate in the CODEMI trial. My name is Jim Christenson, and I'm very honored to be the co-principal investigator with Dr. Karen Humphreys. And the reason for that is that the impact of this trial is really on decisions that we make in the emergency department every day related to patients with potential acute coronary syndrome. I want to bring you some simple information about the trial, but it's important right up front for you to understand that this is a pragmatic trial. It is designed to reduce and minimize the burden on emergency physicians and emergency departments. So what is CODEMI? First, the premise. It is known that women present differently with acute coronary syndrome than men. It is known that they're underdiagnosed or misdiagnosed more often than men. And it is known that their clinical outcomes are worse than for men. Interestingly, when high-sensitivity troponin was developed, when the technology was developed, the threshold or the cut point for normals was based on the whole population, both women and men. It turns out, if you actually isolate women in that analysis, the threshold for normal is lower than it is for men. So the question is, if we applied that lower threshold for women, would clinical outcomes be better? And would there be any unintended consequences, such as increased costs, associated with that change? CODEMI was developed to answer those questions. The intervention is applied to sites that are already using high-sensitivity troponin. The control period is just what you're doing now, using that overall average cut point that applies to both a population of both men and women. What happens is that we randomize each site to change the lab information that comes to clinicians to inform them that the threshold, or the positive and negative values for troponin, are different for women. Every site will go through that change, and at the end of the trial, all sites will be using sex-specific cut points. For a short period of time around that intervention, we're asking emergency leaders to inform the clinicians about the trial, what it is, and what the impact is. We will help with educational materials to be able to do that, but we don't want to influence behavior in any other way than providing that simple information about the different cut points for women. We know that emergency departments are quite variable in their approach to the diagnosis of acute coronary syndrome. Some sites have highly developed and very specific algorithms, and we can help if you need to adjust that so that it reflects those lower values for women. Many sites just allow individual clinicians to use their competent judgment, and we don't want to impact on that behavior or that dynamic in any way other than the lab values. All we ask is that emergency physicians are informed about what it means, and we can provide educational materials, including this short video, if you find that useful. The cohort that we will analyze is defined by patients who present to the emergency department with chest pain and who have at least one high-sensitivity troponin done. The outcomes and further treatments will be discovered by applying that cohort to the National CHI database and other provincial data sources. There is no case report form. There's no need to identify individual patients for the trial during a shift, and there's no need to apply a protocol. So what will the impact of the trial be? We hope that by applying this lower threshold for women, we will provide earlier diagnosis and better clinical outcomes. We hope that you agree that this is a very important question, and the trial, therefore, is very important. And we're very glad that you decided to participate, so we thank you very much.